Good day, this is Richard Nevins here at Rima Insurance. I'm an independent brokerage that represents the beneficiary and the client. Our function is to look at all the carriers and educate our clients on what is the best fit for them and help them transition seamlessly under the coverage of Medicare. Now, I understand that this can get really complicated really fast, especially if you're accustomed to having a coverage with your employer. Be it if you're a teacher, be it if you are working for a company that has had you covered for a very long time. You hit 65 and all of a sudden you get this letter from Human Resources stating that Medicare is going to be the primary, they're going to be secondary. You do have an option to choose something outside of the company, and you want to say, you know what does that look like? How do I do that? That's what we're here for. And I know that during that time, you're going to get bombarded with a lot of letters and postcards from different carriers, be it AARP or Humana, United Healthcare, Care, and it can become so overwhelming that you're like, what do I do? Here, we represent you. We don't represent the companies. We're not a captive agency. We scour all carriers to make sure that your needs are taken care of. We verify that your prescription drugs are taken care of, and also that your doctors are accepting whatever plan it is you're looking for. So what I want to do right now is just concentrate on Medicare in itself, in its basic components. I have other videos that dive into deep parts of the Part A and the Part B and the Part D and the Medicare Advantage. But right now, I just want you to have kind of a bird's eye view of what you have available to you and what Medicare is about. So once you receive that red, white, and blue card, it usually has a Part A and a Part B. And let me take a step back and let you know who qualifies for it. People who have been disabled for more than 24 months here in the state of Texas. They've been on disability for 24 months. They qualify for Medicare. And also people who are 65 and older. Now, when you receive that card, you have a couple of components there. As soon as you look at that red, white, and blue card, you're going to see a Part A. Your Part A is hospitalization, inpatient, skilled nursing. You also have hospice, home health care. That is all part of your Part A. You have your Part B. That's durable medical equipment like crutches, specialized beds, wheelchairs, outpatient procedures, doctor services, preventive. That's all part of your Part B. One thing that I do have to mention is that only covers 80% of whatever the cost is of that health care. So you are responsible under regular Medicare for that 20%, and that 20% has no maximum out of pocket, which means that you only pay X amount. No. The more you utilize it, the more you are responsible for in regards to that 20%, and that 20% is unlimited. For example, you go to the hospital and the surgical procedure costs $100,000, you are responsible for $20,000. If it costs $200,000, you're responsible for $40,000, so on and so forth. So there's no cap to that, which, it puts you in an interesting situation. You might want to take care of that. And pretty much hedge yourself against those liabilities, and that's what we help our beneficiaries do. You also have your Part C Medicare Advantage plans, okay? That pretty much manages your Part D, which D as in David is drugs, your Part A and B, all covered under a Part C, okay? And of course, a Part D as in Davis, which is your prescription drugs plans. And of course, we can take a deeper dive into that. There's other sections in the website, rnevins.com, or on my YouTube channel that pretty much talks about each and every one of them specifically. But right now, we're just giving a bird's eye view of everything. Also, if you want to offset those costs, you do have some options, like Medicare supplement plans, which is your Part Medicare A and B. You have to continue to pay for your Part B. They usually deduct it from your Social Security, or you pay it every 3 months if you're still working. okay? And it usually ranges from $148 to $300 something odd dollars. It just depends what your income looks like. And the Medicare supplement plans are the same as Medigap plans. It's the same thing, okay? It's just another name for the same plan. And those plans have different coverages. They go from A all the way to N, and we have to take a look at what's the best fit for you, balancing benefits with your budget. That's what we try to do here. Also, you have your Medicare Advantage plan, as we spoke about before, which pretty much is a private health insurance company managing your Medicare benefits. Medicare Supplements is a private health insurance pretty much offsetting that 20%, and you usually have to pay an additional premium for that on top of the premium for the Part B. Okay? I know it's a lot. Okay, stay with me. And of course, you have your standalone drug plans for your Part D as in David. A lot of people, they just want to stay with regular Medicare, and they just give me a prescription drug plan, and they can range from $15 all the way to $100, just depending what kind of prescription drugs you're taking, and we would have to kind of give you a consultation to see what's the best fit for you. And again, we don't work for the carriers, we work for you. We are an independent brokerage that pretty much is looking out for your well-being and what is more advantageous for you. So as you can see right here, Part A is hospitalization, Part B as in boy is medical, Part C as in Charlie's medical advantage plans, Part D as in David's drugs, and you have different options to be able to offset and manage the costs of your health plan, which is a Medicare supplement or the Medicare Advantage plans. And again, we can dive deeper. We're going to dive deeper in other videos, but I just wanted to give you the most simplistic of forms for you to understand what is available to you. You can always call us at 469-250-8061, or you can email us, richard@rhymeinsurance.com, and we will respond accordingly. If you want to download this document that has everything explained in regards to Medicare, open enrollment periods, what Part D, A, and B covers, I mean, it just dives really deep into it. Please do so. Just fill out the information, and we will reach out to answer any questions. And our consultation is free. So hopefully this helps you start this journey in understanding what you have available to you. And if you have any questions, again, feel free to contact us. This was Richard Evans. Have a fantastic day.